Is Linda Schwimmer, and I'm the president and CEO of the New Jersey Healthcare Quality Institute. We are thrilled to have you all here today to discuss a really important and exciting issue, the health insurance coverage and New Jersey's new state-based exchange. The Quality Institute, working with our membership, works to improve the safety, quality, and affordability of healthcare for everyone, and having the flexibility and control at the state level over health insurance has long been a goal of the Quality Institute and many of our members. So we are thrilled to have with us today as our first speaker, the Commissioner of Banking and Insurance here in New Jersey, Marlene Caridi. The commissioner was the first commissioner under Phil Murphy and began serving on January 16th, 2018. She is the first Hispanic person to head the department, where she oversees insurance, banking, and real estate industries. Prior to joining the department, she also served 3 terms in the legislature, serving the 36th district in the assembly, and she served on many different committees. Most relevant is the Assembly Financial Institutions and Insurance Committee, which creates many of the laws that relate to Dobie's work. And just some housekeeping items before we start. We are recording this webinar, and we will be sharing it on our website and sharing it with all of the participants and attendees today. All phone lines have been muted to reduce background noise, but we do want you to participate. There is a chat box. Please put questions into the chat box throughout and at the end of the presentations. We will be taking as many questions as we can get to at the end of the presentations. And in addition to the commissioner, today we have a panel of subject matter experts, which include all 3 of the health plans that are selling products on the state-based exchange, as well as an organization that is one of the navigators, and as well as a representative from the New Jersey Health Underwriters Association, which represents all of the licensed producers and brokers throughout New Jersey. So I will be introducing the panel after the commissioner's presentation. And at this time, I am pleased to turn it over to Commissioner Caridi to give us an insight into this really exciting development of our first state-based exchange. So take it away, Commissioner, and thank you again.
Thank you, Linda. Well, I was going to say good morning, but clearly it's 12 o'clock, so it's good afternoon, everyone. And again, thank you for having me here this afternoon with all of you. It's just fitting that I'm here with you and talking to you about what we're doing at the department with regards to our new health insurance marketplace, Get Covered New Jersey. It is very exciting. And as of today, in approximately 18 days, we launch our marketplace for the open enrollment. And yes, we are counting down in days. I even have members of my team that are counting down in hours and minutes. So we're all excited. We see the light at the end of this 1-year process. And so, you know, we're very excited. The marketplace, which is what we're referring to it, will provide many benefits for our state this year. And we will be able to provide more financial help to our residents purchasing a health plan than ever before. And that's due to the state subsidies that was passed by the legislature and signed into law by the governor 2.5 months ago. This would be available on top of the federal credits that are provided by the federal government. So that is exciting for us. This journey led to the creation of the state marketplace is one that goes back years. One that the Governor Murphy had been committed to, and it's because of his commitment that we are able to get to the finish line. We see the finish line, and come November 1st, we will be at the finish line. Not to say that there's not work that will take place afterwards, but when you have your goals, November 1 is the goal date. Our work also would not have been successful without the many organizations and the stakeholders that believe in this effort and have advocated for quality, affordable coverage for our residents and have pushed for and supported the multiple actions taken over the years, specifically these last 3 years as the administration has fought for for improving access to coverage. Under the governor's leadership, New Jersey has led in protecting the ACA, in stabilizing the market, and in increasing access to coverage. Very early on in this administration, the department, Dovie, took on plan management. And that was our first year in office. We took over the plan management of the health plans that were sold on the federal exchange in order to ensure that we knew exactly what the plans had, whether or not they were complying with federal law and, of course, New Jersey law. The continuation of that requirement to have coverage in our state, as well as the implementation of the reinsurance program, allowed us and led us to have rates that were 22% lower than they would have otherwise have been. Over the course of this administration, the state has moved in a very deliberate way towards where we are today. Last year, after enacting the exchange law, the department transitioned to a state-based exchange, but on the federal platform. And while enrollment in the marketplace took place through healthcare.gov, we took on responsibilities of providing for more outreach, of the funding, operating the Navigator program, and we more than tripled the investment in community organizations that provide free education and enrollment help to our residents. That step last year helped in transitioning to the full state-based exchange for the upcoming open enrollment period. For years, as all of you are aware, we have been sending funds to Washington for the use of the federal marketplace. And while we have been doing that, we've been seeing, vital components of the exchange slashed, meaning less funding for navigators, less funding for advertising, enrollment assistance was dramatically reduced at the federal level, as well as the enrollment period being cut by half. By taking the steps that we have been able to take, and the last step, which was last year when we transitioned as a state-based exchange on the federal platform, we were able to take back control and strengthen those critical components of the exchange and redirecting the funding to our state in order to assist our residents. This administration is guided by the principle that all residents of New Jersey should have access to quality, affordable health coverage. And I know that all of you here in this room, in this virtual room, share that same belief. The fact is that most of us know someone with a pre-existing condition, or maybe even one of us here have a pre-existing condition. So we understand why supporting and building upon the work of the ACA is critical. And while our work has been ongoing, the public health emergency that we are facing today has further demonstrated the need to make sure that our residents can go to the doctor, can get preventive care, access to health care when they need it, without having to worry about the financial consequences of getting sick or getting injured without coverage. Linda, your organization, the Quality Institute, has been a strong advocate for quality and affordable health coverage, which is what Get Covered New Jersey's work is about and what it looks to provide. The name of the marketplace should sound familiar to all of you since we launched it back in 2018 when the governor took the administration. And we made it a public awareness campaign to promote then the 2019 open enrollment period. But today it means so much more. At least I believe that it means so much more, and I hope that the residents of New Jersey will feel that same way. A year after Governor Murphy signed the law to establish our own health insurance exchange, New Jersey now has its own health insurance marketplace where residents will be able to obtain coverage and apply for financial help to lower the cost of their plan. Because the state is operating its own exchange, Get Covered New Jersey is able to offer the new state subsidies. We worked quickly at the department to make sure that our residents could benefit from this new law, from the subsidies this year during this open enrollment period. So we were able to incorporate it into the exchange technology platform for the open enrollment period. The new exchange brings meaningful changes to our state. A longer open enrollment period. We've doubled the open enrollment period. So open enrollment starts November 1st, and in New Jersey, it'll end January 31st of 2021. The exchange is tailored for our state, and our call center is staffed by New Jerseyans. 16 navigators offering assistance to residents, which is up from 5 navigators last year. And that's up from only 1 navigator in 2019 when the federal government was in charge. So we've been able to increase our navigator program, and we continue to increase outreach and coordination with assisters, brokers, carriers, and the state, all to benefit New Jersey and, more importantly, to benefit New Jersey residents. The need for affordable health coverage has never been greater, and this pandemic has been cruel to many. Many residents have lost jobs. As a result of losing their jobs, they've lost health coverage, they've lost income, and our goal is to make sure that the residents that are in need of health insurance get coverage from this program and the coverage that is right for them, whether it's the qualified health plan through the marketplace, or whether, and of course, if they qualify for financial help, but also whether they qualify for help through New Jersey Family Care. So we will work together with the Department of Human Services to ensure that we find the right program for our residents here in New Jersey. On November 1st, New Jersey residents who do not have health insurance or have insurance but want to change their health plan will go to getcovered.nj.gov instead of the federal marketplace to enroll for coverage. While the open enrollment does not start until November 1st, New Jersey will soon be able to start browsing health plans and to see if they qualify for financial help. Nearly 8 out of 10 consumers who purchase coverage on the marketplace will qualify for financial assistance. So we strongly encourage all of our residents who need health insurance but may be worried about the cost to visit Get Covered New Jersey and to use the plan comparison tool to see what financial help they'll qualify for. I cannot stress this enough. Most people who apply for financial assistance on Get Covered New Jersey will qualify for help. So if there's one takeaway from today's conversation that I'm having here that I would love for you to share with friends and neighbors and family members, is that there's more financial help than ever available for New Jerseyans this year. As I mentioned before, having our own health insurance marketplace means New Jersey residents will no longer use the federal marketplace to enroll for health insurance. We have been working with CMS to migrate consumers enrolled at healthcare.gov over to Get Covered New Jersey. Consumers with marketplace plans will automatically transition will be transitioned to Get Covered New Jersey. And those who were auto-enrolled in coverage on the federal marketplace will be auto-enrolled in the same or similar plan for 2021, or will be able to pick a new plan. The federal government recently sent out letters to all enrollees last week to notify them of the transition. A wealth of information is available on our website, and we are sending communications directly to our consumers with information about Get Covered New Jersey, including information on accessing their accounts that were transitioned to Get Covered New Jersey from healthcare.gov, as well as information about how to enroll or enrolling in a plan and the additional financial help that is now available. We also know that that due to the pandemic, more people will be seeking coverage through the marketplace. And these are folks that perhaps have never thought to shop on the individual market. Similarly, there will be folks that will be eligible for New Jersey Family Care. And again, they probably never considered looking into that program or coverage from that program. So we're encouraging everyone to come and look and go to our website and shop and see what they're eligible for, because we will help them, whether it's on the individual marketplace or transitioning them over to New Jersey Family Care. We're ready for the open enrollment. We're looking forward to working with all of you as we move forward. Certainly, a lot of work has been accomplished, but the truth is that this is only the beginning. We will be asking all of you for your continued partnership with us over the coming weeks and coming months. Our newly designed website, getcovered.nj.gov, will serve as the front door to the state's marketplace, and we will have toolkits of resources available on the site prior to open enrollment that you can access and help spread the word and pass out. Just as we have in previous years, we will be working to raise awareness for the open enrollment period, and we will rely on our stakeholders and our community partners. This year, there is an added challenge, the public health emergency, and getting residents information in an easy, consumable way with behaviors having changed given this pandemic. So our ability to do things in person is not the same as it was last year because of the pandemic. We will be asking for your help and your partnership because having partners that are as committed as we are is just so important to the success of this program. I look forward to continuing the work that we do with you, and I look forward to the months ahead working side by side with all of you. And again, Linda, thank you so much for having me here this morning, or I should say this afternoon. And I hope that I've given you a little bit of an insight as to where the department is right now and the state-based exchange. So we're very excited at the department.
Thank you, Commissioner, and thank you for joining us this afternoon. I know that that you are very, very busy with your team on launch down to 18 days from now. So it's great that you could join us. I just have a few questions before I let you go and we turn to our panel.
Of course.
Thank you. It's really exciting when you were describing the fact that we have 16 navigators up from 1 and then 5. I'm curious, and I know with health insurance in particular, having that personal touch is always so critical. How can our members and the others on the call today, particularly mayors and others, find out where those navigators are and be helpful in funneling as much, funneling people to those navigators or making those connections as much as possible if they're aware of people who need that extra touch?
So thank you for that question. And it's an important one because our goal is to get the word out, and using our partners, our community organizations, our navigators. And as I referred to you previously with regards to our website, if folks go onto our website, there is a page that will show the assisters and our navigators where they're located. It will have their information, email address, telephone number, as well as our brokers and agents, our insurance brokers and agents. So there's a wealth of information on our website, which is really critical for us to make sure that everyone has access to that information because, for example, as I mentioned before, due to the pandemic, it's not like we will be having that human touch like we had last year. So we're going to make sure that we have resources that can be printed out, access to names of navigators and phone numbers, as well as our insurance brokers that can help with the registration or the purchasing of the plan. So that will all be on our website, as well as information and pamphlets that can be printed out or emailed to the different municipalities and the different organizations that perhaps that you might have contacts with that we don't have, and share that information that way.
Okay, that's great. We will make sure that we get that out to all of the mayors and our Mayor's Wellness Campaign in particular, but good food for thought with all of everybody online in terms of getting that information out. We had a question as to whether there will be any sort of official countdown clock and further PR push as you get to D-Day, so to speak.
So yes, there will be more information put out there as we get closer, and that should be coming out shortly. Like I said, we're very excited, and we're opening and getting ready for November 1 in a hectic but gradual manner to make sure that our T's are crossed and our I's are dotted. So you will be hearing a lot in the next coming days about open enrollment. And of course, we will be sharing information with you and other organizations. So again, the more that we're able to spread the word, the better it is, because our goal is to cover the entire state from north to south, from east to west, make sure that everyone's aware that we have our own state-based exchange. And of course, the fact that this year we have more financial help available for our residents.
Could you give us the sense of, I know it's always going to be individualized, but a range of what that supplemental state-based amount, the subsidy is going to be for your typical individual versus family of 3 or 4?
It depends on your financial situation. And when you go into our comparison plan tool kit, when you go on there and you put your information, it'll break it down for you, and it'll show you what you would get from, say, the federal government, what you qualify for from the federal government, as well as what you qualify for with regards to New Jersey. I don't want to give you a specific number, but examples that I have seen have been about $40 a month. And that's just examples that I've seen. But until you put in your information, you won't really have an actual breakdown of what you qualify for. But again, one of the things that I've seen in the last 2 years was that out of our numbers and through our data, like 8 out of 10 New Jerseyans who did apply on the marketplace were able to get financial help. This year, we anticipate it's going to be a lot more, simply because we have not only the federal credits, but we also now have state subsidies. So we're excited about that.
That's great, right? And that's a key point, that this is on top of what they already received at the federal level, which could make it almost zero out of pocket if from those lower ranges. So that's
absolutely. And again, it might even change a person's mind that instead of buying a plan that's less expensive because they're getting these credits and they qualify for more financial assistance, they might buy a plan that is one level up or has a little bit more. So we are excited about the different options that are going to be available to our residents thanks to the subsidies and the financial help.
Great. Oh, thank you. One last question, and then I know you have to go. Our state did not have a special open enrollment period because of the pandemic. A lot of the other states did. So they probably got to see sort of a sense of a growing interest in the marketplace. I'm wondering if you have any early projections for how much you think the marketplace will will grow either because of the pandemic or just because of now the fact that it's a state-based exchange with an extra, double long open enrollment period?
That's a great question. First, we weren't able to do our special enrollment because while we were a state-based exchange, we were on the federal platform. And despite the governor's request of the federal government to allow for a special enrollment period, it was never granted. So we were not able to help our residents during the pandemic as other states were able to do. This is an environment that we're living in that is something that we haven't seen before. Many folks, like I said before, lost their jobs, and when they lost their jobs, they lost their health insurance. Some folks may not even realize that they're eligible for New Jersey Family Care. So our goal this year is to ensure that all of our residents get the health insurance coverage that they deserve and that they have a right to. To put some context into this, for the first time last year, we saw a growth in enrollment comparing year over year since 2017. So I think that the actions that we've taken in a very deliberate way have helped us to get to the point where last year we saw, like I said, about 1,000 more enrollees over what we had in the previous years. And we anticipate seeing similar growth in numbers and enrollees. And again, because of this environment, it's crucial that we get the information out, because some folks might not realize that they qualify for a plan on the exchange, on the marketplace, or even with New Jersey Family Care. And we want to make sure that they're aware of this and that they get their coverage. The numbers, we'll figure that out after the fact. Our goal is to make sure that we get everyone enrolled.
Okay, fair enough. We'll check back in on you with enrollment numbers come February.
We'll have them for you.
Excellent, excellent. Well, again, I really want to thank you for the time you've given us today, and I know we're in good hands now with the on the ground panel to explain how this is going to roll out, with each of their plans. So you're welcome to stick around and listen, but we know you're busy. So thank you again for your time and sharing it with us this afternoon.
Thank you, Linda, for having me, and everyone, very nice seeing all of you. It's been a while, so take care. Thank you, Linda.
Thank you. So now I'm going to move on to our panel, and I'd like to introduce them quickly. And we've asked each of our panel members, we're gonna do a round robin after I introduce them all, to give us a sense of what external activities they have planned at their own organization to support rolling out their products, or just rolling out the news and the guidance, depending on their role, regarding the state-based exchange, or as we're calling it, the Get Covered NJ, or the marketplace. I keep calling it the exchange, so I'm going to stop doing that immediately now. So we have with us today Desmond Slattery, who's the legislative chair of the New Jersey Association of Health Underwriters, and he's also director of business development at Benefit Mall. Welcome, Desmond. We have Maura Collingscrew. Maura is the healthcare program director of New Jersey Citizen Action. And Maura also, in her role at Citizen Action, is one of the 16 navigators. So she's here today to share the work of a navigator organization. Monica Chopra, who is here, she's the head of the Northeast region for Oscar Health Insurance. Welcome. Michael Constantine is vice president of consumer, small group, and mid markets. And Michael's with Horizon Blue Cross Blue Shield of New Jersey. And Mike Munoz, who's the market president of AmeriHealth New Jersey. And Michael has the distinct position that he gets to do this in two states all at once with his colleagues in Pennsylvania. So he's literally probably getting no sleep. So So welcome all of you, and why don't I start to my right with Michael, and if you could give us a sense of what external activities you have planned to support open enrollment in Get Covered NJ.
Well, Linda, I'm assuming to your right is Mike Munoz, because I could not tell, and I apologize because we've had a lot of technical difficulties on my end today. But we at AmeriHealth obviously have been committed to the state of New Jersey for over 25 years. We've been actively participating on the federal exchange initially since the beginning of it. We're pleased to say that we're the largest on-exchange carrier in the state. And to that point, our commitment has been that we're going to increase the number of folks that we're going to have making outbound calls to each of our members, informing them that there is a change this year by the implementation of the state-based exchange. They also will be setting up times with those individuals once enrollment opens up in November, as the commissioner said, to enable them to facilitate the enrollment if they need to check anything as it relates to their benefits or anything of that nature. The benefit that we have is that having the largest on-exchange population, that 75% of those folks are digitally engaged with us. So for us, where we get pushing out text messages to them, giving them the opportunity to renew via text message through secure text message system that we've set up for them, that will enable them to be able to make all their changes as necessary. So I know COVID obviously has put a little bit of a damper on our ability to actively engage face-to-face with our members in the community, but we're all hands on deck, and we've increased our staff substantially to enable us to be available via telephonic means, or as I said earlier, being able to have those members communicate via text with us to enable them to be able to renew.
Great, thank you. I think I'll stick with the plans and then we'll go to the brokers and navigator perspective. So Michael Constantine.
Yes, and it's great to be on this panel and appreciate, Linda, all your efforts here in terms of putting this together. It's a great group on this panel and appreciate that I'm here with them, especially during these unprecedented times. But we are anticipating, we have about 175,000 members enrolled in the individual space, which is about 60% market share. So we know that it will be a challenging lift moving people from the FFM over to the state-based exchange, but we are ready to do that with as least disruption as we possibly can. In terms of what we're doing, we of course will be working very closely with our broker partners to make sure that they are educating and we're giving them all the tools necessary to educate. But on top of that, we will be working business as usual, as close as that can be with a pandemic. So we have an enormous grassroots organization. We have our Horizon Connect office, which is a brick and mortar that is open today. If you go to several malls around the state of New Jersey, we have kiosks that are staffed today, all with CDC requirements being met and all the safety that is necessary during this time. With our partnership with Ola Doctor, we have facilities in Jersey City and Union City that are open today for people to come in. Again, all CDC compliant, all being cognizant with all the protections that are necessary during this really challenging time for OEP. So stand ready. We believe that it's going to be a historic OEP, and Horizon, as the market leader here in New Jersey, really looks forward to working with everyone to make sure that the word is out, understanding all the things now with the additional state-based subsidy. So there's a lot of exciting news in the marketplace, and appreciate having the opportunity to be here, Linda. Thank you.
Thank you. So I'm going to guess OEP is open enrollment period. I'm trying to
I know,
Got it.
you are correct.
Got
I
it.
will try and reduce the jargon moving forward.
Excellent. Thank you, Michael. And Monica from Oscar.
All right, thank you. First, thank you, Linda and the Quality Institute for hosting this panel, and thank you to the commissioner for her remarks earlier. As the commissioner mentioned, the state's move to a state-based exchange and ensuring quality access to quality care is really more important than ever right now, given COVID-19. So thank you very much for your commitment to New Jerseyans, and Oscar is really proud to be able to partner with you as we venture on this exciting transition. When we think about the kind of new efforts we're putting into place, we've decided this year to really augment those pieces given everything that's going on. Knowing that brokers, the care navigators are really important to supporting our consumers, and then understanding that it's really important to empower consumers with their own information, we kind of have a two-prong approach. First, when you think about member education, the first thing that we're doing is obviously sending emails to all of our current members, enabling them to know exactly what the changes and how they can kind of navigate the system themselves. In addition, this year, kind of similar to some of the folks on the panel, we are also setting up direct calls to our members as well. We understand that this transition might be confusing and want to make sure that everyone really is empowered to understand how they can navigate the entire process on their own. In addition, I'm not sure if folks know or not, but Oscar has dedicated region-based concierge teams. So we are empowering and providing a lot of toolkits to those teams so that they are able to provide any kind of information to any member that calls and requests any kind of information. In addition to consumers that choose to come to Oscar Health to try to learn a little bit more, we have updated all of our online tools with all of the information that the commissioner shared earlier. So for example, if a potential member wanted to understand what their premium would look like, they would be able to enter in all of their information, and everything around the subsidies for New Jersey would be there for them to access as well. So it'd give them an accurate understanding of their options. And then finally, because of the impact of COVID, we also believe that there's going to be a lot more people looking for care on the exchanges. And so there's going to be a lot more ACA shoppers. So we're launching specific campaigns specifically to help support anyone that is first-time ACA shoppers. Flipping to folks that can help support our consumers, we also have augmented our broker education processes. So first, we typically do these in-person meetings with our brokers, but given COVID, we've moved everything to webinars. We held one back in October. We're holding another one on November 2nd. And in between, our New Jersey sales executive is going to be reaching out to every one of their 6 general agency partners to make sure they're aware of all of the things that they need to do. We've also sent out broker newsletters, really highlighting the fact that there are specific things that brokers need to do now that they're going to be supporting their consumers on the state-based exchange. So we want to make sure that they are prepared and able to meet the requirements in order to support their consumers.
Great, thank you. I'm going to turn to Desmond now. And Desmond, maybe before you start on what all the brokers are doing, you could also just share quickly, because I think a lot of people don't think that brokers would even be involved in the marketplace. They think of them more for small businesses. So maybe you could kind of disabuse us of that notion and talk about the broker's role a little bit, and then what the plan is to support the open enrollment period for the marketplace.
Oh, sure. Thanks, Linda. First of all, Linda, thanks so much for putting this, this is a really important event together. And I'd also like to thank the commissioner for her efforts. I know, as I say, in the tech world, this is putting together something like this is a heavy lift. So I actually just got some numbers today, and I wasn't quite sure what they were, but about 25% of the business, the individual business written on exchange, and half of the business off exchange comes from insurance brokers. So, certainly we work very closely with the department, and we have in the past, reached out to, the navigators and the assisters offering them, service. Sometimes they have approached us in reference to specific benefit questions, new plan designs, because I mean, we are the brokers are the experts in this, anything healthcare related. So, we're all in this together, but certainly, it's a big part of our business.
Just to clarify for everyone, when you say on exchange, you're talking about the state-based exchange now with the subsidies versus off exchange being the fact that we still have in New Jersey an individual market that we've had since '93, but it doesn't have the subsidies. Please clarify what I said, but I don't know if everyone is even fully cognizant of that, and I think it's important.
Yeah, so there's, I guess the enrollment, and I guess, Mike and Monica can chime in, but I think the overall individual enrollment now is about 300,000. And I think 90,000 of those enrollees are off exchange. And some of the plans are similar. There's a couple different offerings there. So, we assist both on and off exchange.
Yeah, Linda, I think the important key to note that the state took the necessary moves to expand the number of products that they're offering off exchange for those individuals that did not qualify for subsidies through the federal subsidy program. And it essentially gave us the opportunity to offer lower price programs for those individuals off exchange to provide a competitive option for them because they did not qualify for a subsidy. So I think it's an important thing to note of the differences. So you can see a plan design on exchange that's off exchange, and it could be the identical plan design, but it could be a differential in rate at a lower rate because they're not receiving a subsidy. So with a focus on affordability.
And Linda, the point that, and the important point, and you raised it with the commissioner before, without having to pay during a year with the pandemic, when you've seen so many employees leave the roles of employer-sponsored plans, the fact that having a really vital off exchange with where you're not getting subsidies is critical. So that's an important point here during these times.
No, thanks. And Desmond, I didn't want to cut you off. I wanted you to finish what you were saying, but I just wanted to make sure people knew that the world was bigger than just the three, these plans as well. So.
Yeah, absolutely. No, thanks guys for jumping in there. So I'm not sure where were we now? So I think we were talking about our outreach. So so the brokers, the brokers have all gotten licensed. They're all licensed. They've all gotten certified, and they're familiar with the Get Covered NJ, and the outreach has started in reference to promoting the exchange and the subsidies through, via email, social media, webinars, Zoom events, calls. So many things that the other folks have already mentioned. I did want to give a special shout out to a friend of mine down in South Jersey who specializes in this. His name is Scott Hafetz, and he has quite an expansive individual effort. And so I said, Scott, what are you doing? So he said he's got billboards across the state, ads on the ScarletKnights.com, ads on NJ.com, sponsored content on NJ.com, ads on Facebook, Instagram, local radio stations, web leads, Zoom seminars. So, all of the NAHU members are doing a lot of different things to get it out. This is an important part of our business, and we're very excited about this. The new state-based exchange, and the added controls that we're going to have here versus the big sprawling federal exchange. So the broker community is very excited about this.
Great, thank you. And if we get everybody to do those billboards, I think that'll help, right? Then people will know about it. So Maura, great. I wanted to hear what Citizen Action and its other Navigator colleagues are going to be doing to support this, getting the word out.
Yeah, thanks so much, Linda, for having us and bringing a different perspective into a really robust discussion here. So Citizen Action has two arms. We do direct service work, which is where our Navigator program is going to be based. We have an office on Halsey Street in Newark, which may have the opportunity to open with limited in-person help. But right now we're planning, like many of the Navigator agencies, for a fully virtual enrollment period. So people will be able to contact our agency directly to get enrolled, to speak with the Navigator, schedule an appointment, and get themselves enrolled and ask all the questions they need to ask. On the other side of the equation at Citizen Action is a lot of the outreach, education, and policy work that we do. And for the last 8 years, we have been engaged in outreach and enrollment to promote the Affordable Care Act and the open enrollment period. And with the generosity of the Robert Wood Johnson Foundation, that work is continuing again this year. At Citizen Action, we convene NJ for Healthcare, which is the state's consumer health coalition. And many of those partners are engaged in a coordinated outreach program to try and let consumers know what's available. We have a large focus on hard to reach populations. There's been a lot, as any of you on this call know, you have had to deal with the back end, the business piece of a lot of the attacks that have come out against the Affordable Care Act over many years. The impact on the population that we deal with has been a lot of people have come to be fearful of enrolling, particularly immigrants. Those in immigrant communities have shied away from enrolling. We've heard from some of our partners, people have actually dropped out of coverage, which really is not necessary. So for our part, what we are doing is a lot of what you've heard from Desmond and the others, the insurers. We're doing a full out education plan. We have videos that will be rolling out, but the videos will be testimonials of people from within the community talking about the importance of health insurance. We have a toolkit that's going out, email alerts. We will be text banking, doing teletown halls, Facebook Live events with various experts who can help people to understand what's available, how they can connect with assistance, and how they can get enrolled. The other thing that we are hopeful to be able to do is distribute materials so that elected officials can make those telephone calls and robocalls that will let people know open enrollment is here, this is what you can do, this is how you can get enrolled. So I think that the groups that are involved and those navigators who will be doing the work this year that have greatly been expanded have been at the forefront of this for many years. And I think, we're geared up to see a really successful campaign. I will just say to Desmond's point, as the cutbacks at the federal level increased, the importance of brokers and even call centers at the insurers were more and more important. So in any of the outreach, all of the outreach that we do will include all of the resources for how people can connect to someone to help them get enrolled, because that's the bottom line. That's the goal, to get as many people enrolled. And like Michael said, we think this could be a record enrollment period. So really anxious to see where it goes and think it's a great thing for the people of the state of New Jersey.
Well, thank you, Maura. And just to add to that, we've asked all of the participants on the panel today, as well as the department, to provide us with all of or any outreach or marketing materials that they would like to share to really support this effort of getting the word out. So when we send out and post the webinar link today, we'll also have a lot of these resources available for all of our members, and we'll be including a lot of it in our newsletters and other outreach ourselves. So, so look forward to having a lot of these links and things. I know, not surprising, there's so much content and great speakers. We are running low on time. So I want to remind folks that are listening to please go ahead and chat questions into the chat box. But I still have a number of questions, so I'll continue with those. And Mike Munoz, this one's for you. What, and then for others to chime in if they'd like, but for people who previously shopped on the federal marketplace, what can they expect to see the same and then different as they go to get covered in J soon?
While the process may be slightly different, I think the similarities in them having the ability to be able to access the available plans within the state, along with, if they check with, as some of the other panelists said, they check on the website for each of the carriers, they'll be able to determine what their federal subsidy will be available to them. And obviously reminding folks that they have the ability to have access to a local subsidy through New Jersey, obviously is an important part of the marketing that we've been doing. We just hosted this morning over 150 brokers where we talked about our product offerings and reminded them of the fact that not only is there a federal subsidy available this year, but also that there is a local New Jersey subsidy that's going to be made available to address the affordability issue in the state. So I think it's important when somebody's going to shop this year that they recognize where they have to go, number one. Number two, that there's additional financial resources available to them that could make it even more affordable for them if they take the time to work with their broker, work with a navigator, work directly through our licensed agents. They have the ability to do all of that. Or if they choose to do so with us, because 75% of them are still digitally engaged with us, that they have the ability just to renew via a text message with us, a secure text message, they choose to do so. So I think they have a lot of options out there. And I think more than anything is really getting the message out that they're going to a different place. But I think the look and feel will feel very similar to what they've experienced in the past.
Great, thank you. So we have a question about the rates, which I think you guys all know with this market in particular, it's the most price sensitive. That's what it's all about. Do we have a sense of what the individual market rates are going to look like for this coming year? Are they going to be lower, higher, any variation based on product? Michael, let me start with you on that one.
Michael C. or Michael M?
You.
Okay. So it's a great question. So we're pleased to say that our average increase in the individual space is about 1.4% this year. And I do want to mention, and the commissioner should be lauded as well as the governor, because the foundation of affordability really was laid a couple of years ago with the reinsurance pool that was set up, and also when the federal government stopped enforcing the individual mandate, the state stepped forward and then still made that, kept that mandate in. So that impacted rates overall by about 15%. And I think that it did an awful lot in terms of stabilizing the market. And then now we go from there. So, and also, so those are the rate increases, but the additional state subsidy is critical. So here's where the difference lies. So the federal subsidy and the state subsidy, it still is up to 400% of the federal poverty level. But just as an example, the federal subsidy really didn't take into consideration how many members within a family, and the state subsidy is going to do much more of that. So just a couple examples, and I know that we were talking about that before, but if you have a married couple, 45 years old, essentially, with 2 kids, an annual income of about 100,000, they would have paid $815 last year for 2020 with the federal subsidy. This year coming up, they're going to pay about $439. So the state subsidy is also higher on the FPL scale. And in addition, it takes into consideration those that have multiple either children or members within that particular family. So that's one of the main reasons why, if you're, another example, if you're a 30-year-old mom with 1 child making $40,000 a year, and that's about $20 an hour. So what's that person would have been paying was $260 a month with the subsidy. That's going to get down to $175. So overall, I think the rates across the board, with all the things that have been happening over the past couple years that the state initiated, our increases on average are going to be less than 2%. And we think the subsidy will be very beneficial. And that's why we're bullish that it's going to be a very large open enrollment period.
Great, thank you. I think if folks don't mind, I'm going to go about 5 minutes over because there's a lot of good questions that we still haven't covered, and this is important, timely stuff. And I want to give Monica and Michael a chance to answer that rate question, and then one last question for Maura and Desmond to wrap up. So, Monica, what do you think on Oscar's rates, and
Sure.
bullish on the market like Michael is?
Well, I'll say for us, the transition to the state-based exchange has not impacted our rates specifically. I completely echo Michael's comment about how we do believe the subsidies are going to be a really big game changer and are really helping meet the market where it is and what consumers really need. So I think he really laid it out very well, but we agree.
Okay, and Mike?
Our average increase for this year is about 5.6%. And that also accounts for the additional tax that was put in place to fund the subsidies that we're all talking about that'll be made available to make the programs more affordable in the marketplace. And I think it's important to note that, we as a company have really positioned ourselves to enable us to be successful in the lower price category. And I think that's really where we've been able to win historically, and that's enabled us to position ourselves to be the largest on-exchange carrier in the state. So I do feel pretty good, as Michael said, as it relates to the market and what we'll be able to bring this year.
Okay, thank you. And that's a great segue too for Maura and Desmond. So for folks who maybe had employer-sponsored insurance before and are shopping for the first time, and I know this is a big question, but please, keep it to the top level. So what advice do you have for that first-time shopper? We'll start with Maura.
Our favorite go-to line is, it's free to shop, and you'll be surprised what you're eligible for. That's really the message. It costs you nothing to shop. And I think all of the numbers thrown out here are really demonstrative of the surprise people will have when they shop the marketplace this year. Excellent.
Desmond.
Hey, Maura, that's a great line, free to shop. I like that. This is going to be a shameless plug, but if I were a consumer who's never shopped for a plan, I would seek out the services of a licensed certified broker, the same as you would as if you were shopping for any other professional service. There's no additional charge or fee, and the premium is exactly the same whether you use a broker or not. And then one of the things about working with a broker is that they'll handle customer service issues throughout the year and don't go away after the open enrollment process has been completed. I'm looking forward to working closally with Maura and the other folks here in reference to this promoting the Get Covered. One last piece of advice in reference to shopping: start now. Get familiar. I would tell folks to get familiar with the website. if you haven't seen it, it's a really neat, clean, easy to navigate, no pun intended, website. And I want to congratulate the commissioner on getting that put together. And I think that all the tools that are on the website and also the carrier tools will be very valuable in helping folks make the right decisions.
Thank you. I really want to thank all of you, Michael, Mike, Maura, Monica. Wow, it's like a nice symmetry there. and Marlene. It's been really a lot of fun, a pleasure to speak with you this afternoon. We will again be making these materials available, and we will be connecting really with all of you throughout from now through the end of January on making sure that the state marketplace, Get Covered NJ, is successful. So thank you all for your time today. Thank you everyone who is listening. We appreciate your engagement and membership in the Quality Institute, and look forward to seeing you on another webinar and eventually in person again soon, hopefully one day.
Thank you, Linda.
Thank you, Linda.
Thank you.
Thank you. all.
Thank you.
Yep. Take care, guys.
Thank you. Have a great day.
Bye.